I'll shift now to public health benefits, and here we point to the American Lung Association because they have done a ton of work on this front. And we'll cite two of their reports, which are pretty similar, but have really good data. So first, the American Lung Association modeled what it means for emissions to shift to 100% of new car sales by 2030 and 100% of new medium and heavy duty vehicles being electric by 2040, along with 100% renewable energy. So obviously not every state is on this trajectory, but they modeled out if we were to be, what would that mean? And they found really dramatic benefits with regards to key pollutants like nitrogen oxides and volatile organic compounds, which together react in the atmosphere to create smog, which increases chances of asthma, heart attack, stroke, and more. They also found dramatic reductions in fine particle pollution or particulate matter. PM 2.5 specifically is what they studied. PM 2.5 increases chances of asthma, lung cancer, heart disease, lots of other things. And they also found significant benefits in reductions of sulfur dioxide emissions, which reduce lung function. All of those are abounding in our air right now and causing lots of health harm, which I think not everybody realizes because we don't have smog the way it looked like in the 70s, but these are really still creating real harm. And that's something that we saw in how COVID impacted different communities and places where there's more pollution like this. People's lungs were less able to deal with the challenge of COVID. The American Lung Association has this somewhat intimidating table that shows by 2030, 2040, and 2050 what emissions reductions we see in each of those categories. We're not going to go through every box on this, but I wanted to point out two things on this. One is that light duty vehicles see the biggest impact really in the greenhouse gas emission bucket. That's hundreds of millions of tons per year emissions reductions in this scenario that they modeled. And medium and heavy duty vehicles see a much larger impact in nitrogen oxides and really all of the pollutants that harm human health. This is something we've talked about in previous webinars and blog posts before, that medium and heavy duty vehicles, particularly those that drive on diesel fuel, are really disproportionately polluting in terms of public health. So together, these emissions reductions really add up. In a separate report, the ALA added all this up in terms of what it means for dollars. And so here they studied the cumulative health benefits from 2020 to 2050 for every state in the country, assuming all new vehicle sales are electric by 2035 and that we've got non-combustion power. In Massachusetts, those health benefits totaled $14.7 billion. So that is specifically avoided asthma attacks and ER visits, avoided lost days of work, and avoided premature deaths. And in Rhode Island, that totaled to $3.2 billion. So these are expenses that we will pay in other ways if we don't make the transition to electric vehicles. Moving on, I want to highlight two important facts when it comes to public health. The first is that health harms from internal combustion engines are not distributed equally across communities. They are most felt in low-income communities and communities of color. Here we'll point again to a study from the Union of Concerned Scientists, which looked at the exposure to PM 2.5, that particulate matter, for different populations across the country. And it found that Asian, African American, and Latino or Hispanic communities are much more likely to be exposed to particulate matter pollution from vehicles than white communities, or in this case, also Native American communities. And there's similar data like this from Massachusetts and Rhode Island that tells the same story. And then secondly, we want to point out that climate change itself is a public health threat in so many ways. And there again, the harm is not distributed equally. It's low-income communities and communities of color that are hit first and worst, internationally, nationally, and in Massachusetts and Rhode Island. So transitioning our fleet of vehicles from fossil fuel-powered vehicles to electric vehicles addresses this both directly and indirectly.